Hello, and welcome to episode 7. So this is going to be a pretty cool episode. And we're going to be chatting about a topic that I get asked a lot about. So the name of the episode is What's in a Title? Basically, we're going to be sort of talking about all the kind of myths and debunking the myths of the different pet behavior professionals and enlightening all the pet caregivers out there as to which type of professional they should choose if they're worried about their pet's behavior, because there are so many different titles and letters and abbreviations and all kinds of things out there, and it can get super confusing and super overwhelming. We're basically going to be talking about what are veterinary behaviorists, what are vets who have a special interest in behavior medicine, what are non-veterinary behaviorists, and then also where do dog trainers fit in. So it's going to be quite a busy episode in terms of I'm probably going to be throwing a lot of kind of names and letters at you, but don't let that put you off. I just want to give everybody a bit of an understanding of the field and to basically help pet caregivers out there to choose the right professional for them. All right, so I'm going to start with veterinary behaviorist because obviously that's most familiar to me. That's what I am, or I am in the process of becoming. And that's really where the first kind of piece of the puzzle starts. So a veterinary behaviorist with IST at the end basically indicates that you are a specialist, and that goes for all the other veterinary specialities too, whether you are a dermatologist or an ophthalmologist. Whenever there's an IST at the end, that suggests that that person is a specialist in that field. And in order to become a specialist in that field, you have to have gone through a residency program, just as I'm doing, and you have to have passed an examination at the end of that residency program, which is pretty rigorous. And that's then when you can call yourself a specialist. Each of the specialities are governed by different colleges, and there are different colleges around the world. So in the case of veterinary behavior medicine, we have 3 colleges, I can say. So we have the American College of Veterinary Behaviorists, the ACVB. We have the European College of Animal Welfare and Behavior Medicine. And then we also have the Australia-New Zealand Fellows, or the fellowships, which is the Australia-New Zealand equivalent to the American and the European colleges. So those are the 3 kind of big governing bodies as far as veterinary specialists are concerned. And unless you have gone through that residency program and you've passed the exams, you cannot call yourself a veterinary behaviorist. So myself at the moment, because I'm at the end of the residency, I haven't yet taken my exams. I am not allowed to call myself a veterinary behaviorist yet. I can call myself a veterinary behavior expert, or I can call myself a vet with a special interest in behavior medicine. I can also say that I'm residency trained, but I can't say that I'm a veterinary behaviorist. So that's one really big thing to take in mind. And specialists are pretty protective over their titles, and so they should be, because they've spent a lot of time in these residency programs. It's a lot of hard work. The research publications and all the other things that you have to do. So specialists quite rightly get a little bit put off when people that haven't gone through that program call themselves an IST or a specialist. And actually, in some countries, if you advertise yourself as being a specialist or you call yourself a veterinary behaviorist, then that is actually punishable by law. You can get fined. You can even be incarcerated for that. So it's pretty rigorously controlled. And so it should be. If you are a veterinarian who has a special interest in behavior and behavior medicine, you can do the Australia-New Zealand membership exams, which is what I've done. So that's a certificate level. It's not a specialist level. It's kind of a step below that. It means you have a kind of a better knowledge than the average veterinarian in that particular topic, but it means that you're not yet a specialist. So, for example, I also hold the Royal College of Veterinary Surgeons certificate in veterinary anesthesia and analgesia. So that means I have kind of more knowledge in that area than perhaps many other vets. And I also have the membership exams in veterinary behavior medicine. So currently I have 2 certificates, and they just indicate that I've studied that topic extensively, and I have also taken an exam to become either a certificate holder or a member of the Australia New Zealand College of Veterinary Scientists in veterinary behaviour. So that's another thing that you can look out for. Or you could absolutely be a veterinarian who has a special interest in behaviour medicine. You might have a different qualification, and I'll mention some of these in a second. Or you might be a veterinarian who has a special interest in behaviour medicine and you don't have any qualifications. So, those are all possibilities. However, I would definitely say that the more complex your case may be, or the more, the better trained a professional that you would like to consult, that's when you need to start looking for those certificates or the diplomas, the veterinary behavior specialists. So that's a little bit about us vets, but how about everybody who's not a vet, but also calls themselves an animal behavior consultant, for example, or a non-veterinarian behaviorist? So this is where the waters start to get a little bit murky, because essentially it's quite an unregulated area. So anybody who's not a vet and has maybe done a weekend course in animal behavior can call themselves a behavior consultant or even a non-veterinarian behaviorist, and you will find lots and lots and lots of those people. And that this is dangerous because it is unregulated. There is largely no kind of minimum standard for that. However, there are now a number of governing bodies or associations that non-veterinary behaviorists can become members of, that allow the public to understand that they really have had good training, they've had to sit some exams, and in particular, they have to continue on with their professional development and attend lectures and keep their what we call CPD, continuous professional development, up to scratch. And I'm going to chat you through a couple of these associations, which will hopefully help you if you are looking for a non-veterinary behaviorist or a non-veterinary behavior consultant to help you with your pet. Then being a member of some of these associations may help you try and understand, what kind of level of experience and what kind of qualifications they have. Okay, so I'm going to start with 2 international organizations, which are pretty big, and they're kind of umbrella organizations, and they're sort of internationally accredited, I would say. So the first one is, and this is where all the acronyms start, so bear with me here. The first one is the CCPDT. So that is the Certification Council for Professional Dog Trainers. So they are a council, they are a professional body that particularly look at certification when it comes to dog trainers. And the CCPDT actually have 2 sub-classifications. You can become a certified professional dog trainer, or you can become a certified behavior consultant in canines. So that's a CPDT, certified professional dog trainer, or a CBCC, certified behavior consultant canine. And then if the person has a KA behind that, that means that they've been knowledge assessed. That means that they've had to take a 3-hour exam showcasing their knowledge in these areas. So if you see a professional that has any of these letters, CPDTKA or CBCCKA, that's what ILSA is, for example, then that's a pretty good standard, and you know that they've had to demonstrate a certain level of knowledge and skill in that area to pass that examination. So that's the first one. The second international organization that I'd like to mention is the IAABC, the International Association of Animal Behavior Consultants. And amongst this, or under this umbrella, you can get lots of different types of certifications. Some of them are species specific, so either for dogs or for cats or even for parrots or other species. And again, the IAABC is quite well recognized and quite well known as an institution of kind of good quality when it comes to the standards that people have to demonstrate to become a member of that. And again, there's a certification process, so people have to demonstrate their knowledge and their skills. And one of the really important things is that keeping up with CPD. So in order to kind of reaccredit or to keep your certification upright or going, you have to demonstrate that you're either continuing with your professional development, so you have to log a certain number of CPD hours, or you actually have to retake an exam it's usually every 3 to 5 years. And by the way, us veterinary behavior, soon to be specialists, we also have to do the same. We have to reaccredit every 3 to 5 years, depending on the college. So we have to demonstrate that as specialists, we keep our continuing education going. So we either have to continue seeing cases, or we have to demonstrate research, we have to demonstrate publications. So that's always a really good benchmark for understanding if your pet care professional is sort of keeping up with newest developments, learning more, continuing to develop in the field. That's always a really important piece. So that's the second international organization, the IAABC. Now I'm going to switch over a little bit more to Europe. And I'm going to talk about a couple of different associations that are quite well known, especially in the United Kingdom. So we have the FABC, which is the Fellowship of Animal Behavior Clinicians. So I'm a part of this group as well. So you can have veterinary behaviorists in this group, but you can also have non-veterinary behaviorists, or you can have vets who are not part of the colleges, who are not going through a residency program, but there are something called CCAB, which is a Certified Clinical Animal Behaviorist. And you can have both vets and non-vets in this kind of group of professionals. So the Fellowship of Animal Behavior Clinicians, the FABC, they actually have a registry. So if you're looking for a pet behavior professional to help you with your pet's behavioral problems, and you're perhaps located in the UK or in Europe, you can go onto the FAB website and you can have a look in their directory. They'll have all the different people who are accredited with them on there, and you can choose whomever you feel drawn to. So the FABC is a really good place to look. And like I say, CCAB, so being a certified clinical animal behaviorist. So if somebody has that behind their name, CCAB, whether they're a vet or not a vet, again, that means that they've demonstrated a certain level of skill and knowledge to receive this accreditation. The other place in the UK that I think is a good place to look is the ABTC, the Animal Behavior and Training Council. This is an organization or an affiliation that kind of has pet professionals within them. I would say perhaps not quite as well trained as members of the FABC, but another good place that you can look. And then I have a couple of others. One is COAPE, COAPE, which is the Center of Applied Pet Ethology. Again, Ilse is part of this. If you haven't met Ilse yet, listen to episode 2. So Ilse is the non-veterinary behavior consultant / trainer who works together with me. So she's also a member of COAPE. So she did all of her qualifications through COAPE. This is a very well-recognized training facility if you're not a vet. So that's the Center of Applied Pet Ethology. And they also have a qualification or a title, which is CAPBT, so the COAPE Association of Pet Behaviorists and Trainers. So people who are part of that often have a diploma. So CAPBT DIP, the diploma in that area. So again, that's what Ilse has. And again, I would say this is a pretty good group to be looking at. So if somebody's done their training through this group, I would say that they've got a very sort of nice experience or a very nice theoretical basis when it comes to pet behavior. So those are kind of the big ones. Again, apologies for all the letters and the abbreviations, but I think it's really important that we start to, in this very unregulated field, is to start putting some kind of standards in place or putting some names out there, things to look out for when you're actually looking to work with a pet behavior professional. So there are a couple of other things that I want to chat about, and we're kind of crossing over into the realm, I guess, more of trainers now. And I wanted to try and explain a little bit what's the difference between a behaviorist or a behavior consultant and a trainer. And because I think this is also a pretty big distinction, right? So a behavior consultant or a non-veterinary or a veterinary behaviorist, I think we really look at the animal's behavior in quite a holistic way. So certainly us as veterinary behavior professionals, one of the sort of really big areas that we can look at that none of the other professional bodies can look at is physical health contributions to behavior. So we can make sure that we have no signs of pain, other systemic diseases, neurological diseases, any other kind of I guess, diseases that we as vets are responsible for, and we can diagnose and we can treat. So we can look at other big contributors to behavior, which the other professional areas, so the non-veterinary behaviorists and especially the trainers, are not really qualified to look at. The other thing that we as veterinarians can do is we can prescribe medications, right? So again, none of the other professions can prescribe medication. They might know a little bit about medication. They might have attended some, additional training or some CPD on medication, but they are in no way qualified to recommend or prescribe medication. That is solely the prerogative of veterinarians. So again, behaviorists can maybe tell you, have a think about medication. I think medication might be something that we could look at, but they have to put you in touch with a veterinarian to be able to actually get that. Okay, so that's a little bit of a distinction. Again, back to vets, but we were talking about the distinction between an animal behaviorist or an animal behavior consultant and a trainer. So as behaviorist or behavior consultant, we very much look at the animal's underlying motivations and the animal's underlying emotional state. That's something that's really, really important. And that's something that massively influences how we move forwards in terms of treatment plans and the kind of advice that we give you. So we always want to try and understand why. Why is this animal performing this behavior? What intrinsic need is it fulfilling? Or is there a pathological component to this behavior that doesn't fulfill a specific need? So I'm thinking here about compulsive behaviors or stereotypic type of behaviors that don't seem to fulfill any kind of need, that don't seem to have any obvious motivation, although again, that's a little bit debatable. But we always want to try and understand why. Why is the animal doing this behavior? What is it fulfilling in them, and what needs is it meeting? And very much a big part of that is emotional state. So are they behaving out of fear, out of anxiety? Is this a coping mechanism in terms of stress? Are they behaving out of frustration? Are they behaving in a certain way because of pain? Or is this a panic, grief motivated behavior? Is this a natural exploratory behavior that might be unacceptable to the caregiver? So we also look at, is this behavior completely and entirely normal for this animal? And is it just inconvenient or inappropriate in a domestic setting, or, for the particular caregiver? And if that's the case, then what can we do to fulfill that animal's needs in another way, so it doesn't feel the need to perform that particular behavior? So it's that holistic approach, and it's that questioning what lies underneath. So we're not just trying to stop behaviors or eliminate behaviors. Yes, that can be the end goal in some instances, but we're always asking the why question. We're always looking inside the animal to see, is there a physiologic purpose? Is there a physiologic need that this is fulfilling? And what can we do? And what are the tools at our disposal? Again, this is where vets differ to non-vets. what are the tools at our disposal that we can help that animal and in the long run, change behaviors. So that is, I would say, from a sort of a veterinary and a non-veterinary animal behaviorist or consultant point of view, that's how we look at things. When we're thinking about trainers, and I don't want to do any trainers any disservice, there are many, many trainers who are incredibly skilled and very, very good at what they do. And many of them do also look at that kind of underlying motivational state. But when we think purely about training, what we're thinking about here is really the operant. And when I say operant, that's a term coined by Skinner many, many years ago. But that's basically the encouragement of wanted behaviors and the discouragement of unwanted behaviors. And we talk about the 4 quadrants. We talk about positive reinforcement, negative reinforcement, positive punishment, and negative punishment. And this is really about behaviors that are driven by kind of, I would say, muscular actions. So think the classical one is teaching a dog to sit or to down, for example. We're encouraging those very kind of muscle related behaviors, performing a sit or performing a down or performing a hand touch or a nose target, all those types of things. And we always look at the consequences, right? So the consequences that the animal experiences by offering a certain behavior is what then informs the animal as to whether they should do the behavior again or whether they should stop doing that behavior. And it can be, so training or operant conditioning, as it's also known, can be really useful in many instances. However, it does come also with a number of challenges. And oftentimes when we look at things from an operant perspective, we tend to forget about the underlying emotional state and the underlying motivation, because it's really just about changing behaviors. So, for example, if I were to diagnose an animal with an anxiety disorder, operant training might not help me a whole lot, certainly at the beginning, because what I'm trying to do is relieve that animal's anxiety by increasing safety and security, by readdressing neurochemical imbalances in the brain, by making sure that we've got no physical medical contributions, all that kind of thing. And it's unlikely that the operant is going to help me there in the first instance. So, for example, if a dog is barking at the door, let's say because it's fearful of something, it's fearful of the unknown outside that front door, or it's fearful of somebody coming into its safe place. So if a dog is barking at the doorbell or at the door because its emotional state is a state of fear and anxiety, then teaching an operant behavior such as go to a mat or go to a place or perform a certain behavior when the doorbell rings is unlikely to address those fears and that feeling of unsafety. The animal may be able to be trained to do that thing, to go and sit on a mat or to go and lie on a mat or lie in a certain place, but it will likely not change how they feel about that situation. So that's something that we really want to think about when we are thinking about trainers. And then, of course, there are many, many trainers who use methods that we perhaps don't think are very beneficial. So if you hear anybody calling themselves a balanced trainer, then I would probably stay away from that. Balanced means that they're employing all 4 quadrants of the Skinner 4 quadrants. So that means they are using positive reinforcement, negative reinforcement, positive punishment, and negative punishment, all 4 quadrants. And we certainly know that punishment is not helpful for many, many reasons. And we're going to do a separate podcast episode all about punishment. But we don't want to be employing those methods. So I definitely would say stay away from balanced trainers and stay away from any trainers who use aversive methods, force-based methods that are shock collar trainers, or who are trainers that really use quite punitive methods. And there are still, unfortunately, quite a few of those out there. So we want to definitely stay away from that. One of the biggest recommendations I can give when you are looking for either a trainer or a pet behavior consultant to work with is to actually see them in action. See if you can watch one of their sessions. If they're a trainer that offers group training classes, ask if you can go and watch, ask if you can go and kind of stand on the sidelines and just see how they interact with the animals, how they interact with the humans, and what kind of methods they employ, whether you feel that that's something that sits well with you or not. Many trainers call themselves positive reinforcement trainers. And then unfortunately, when you actually go and see how they work, that might not necessarily be the case. And again, I don't wish to step on anybody's toes here. There are so many amazing and incredible trainers out there who have got great qualifications, who have dedicated their careers to helping animals. And I could recommend, a handful right off the bat. So I'm not saying you shouldn't use a trainer, but if you do use a trainer, then, that might be for agility training or flyball training or trick training or something really fun that you want to do with your animal. But if you experience a behavioral problem, something that is concerning you, something that is a behavior that, is troubling and maybe not quite right, then I would perhaps say a veterinary behaviorist or a vet who has a special interest in behavior medicine is your first port of call. If you can't find one of those, one of us, then maybe a pet behavior counselor or a non-veterinary behaviorist. So there'll be different indications for different things. For puppies, it's always a bit of a tricky question. So we want to teach our puppies life skills. We don't necessarily want to obedience train our puppies. It's fun to teach them a few fun tricks and that sort of thing. But what we really want to do with our puppies is we want to give them coping skills to be able to cope with the world and to live in our domestic environments in harmony with us. And again, that's a topic for another day. We'll definitely do another podcast episode on puppies and also kittens. But I think that's kind of what I have for trying to unpick this hugely complex topic of which professional to choose to work with when it comes to your pet's behavior. So let me know if you have any questions. Let me know if you have any comments. And I hope that you've enjoyed this episode of 7, What's in a Title. And we look forward to seeing you in the next episode, which is episode number 8, where I'm actually going to be talking to an amazing pet caregiver called Alex about her kitty cat Tiglet's behavioral journey. So can't wait to see you then, and bye for now.